museums have the power to promote well-being and mental health. They do this by assuring social interaction, relaxing experiences, new learning, new skills that may allow the increase of self-esteem and identity and reduce the levels of isolation or anxiety. There has been a movement in Europe in the last decade to promote the social role of a museum for therapeutic framework within local communities. That is, the possibility of occupying users with tasks in museum by medical indication. And this new approach has been called cultural prescribing. Departing from a partnership with the museums of the University of Edinburgh, the National Museum of Natural History and Science of the University of Lisbon is coordinating the Museums and Wellbeing Cultural Prescribing project developed by a network of national entities, health center, student support offices in different faculties, daycare centers, research centers, aiming to prepare Portuguese museums and botanic gardens for cultural prescribing to include university students, seniors, and neighboring communities. They will develop activities with collections, with museum collections prescribed by doctors and psychologists as therapy. This approach may therefore contribute not only to foster confidence and well-being, but also to connect people with heritage and promotes social inclusion. We have already very good results about the impact of this project. We received from March 22 until last summer 5 university students diagnosed with burnout and anxiety, 4 clinical patients from the health centers diagnosed with depression and anxiety, and 22 senior people from daycare centers with a profile of social isolation and depression. The results of the interviews done were very elucidating, and they indicate well-being promotion of these cultural prescribing initiatives by allowing stress reduction, competence, and enjoyment among the university students, by promoting self-confidence, competence, and social involvement among clinical patients, and helping social involvement, enjoyment, and place attachment among senior people. So, for museums, the main challenge is to integrate into their staff people who can develop these cultural prescribing interventions together with doctors and psychologists. And therefore, the task has been allocated to the educational services of museums because they include professionals with experience and skills for the work with such different audiences. However, training is really necessary and urgent, and that's why we are already organizing a training course together with the museums of the University of Edinburgh to be developed during this year about this theme. This Museums and Wellbeing project foresees a broad involvement of the national and international academic community in the research about this topic, including the development of impact assessment being a very, very important fact to include in this study, in this project, in order to have results to justify the interventions. It is intended that other health units, universities, and museums join this network to promote cultural prescribing, not only at a national level, but also, of course, at an international level with other similar projects.